Now, this is a newborn hearing screening, which means that this is a JCAH statement. Newborn hearing screening is a standard of care in hospitals nationwide. The primary purpose of a newborn hearing screening is to identify newborns who are likely to have hearing loss and who require further evaluations. A secondary objective is to identify newborns with medical conditions that can cause late onset of hearing loss and to establish a plan for continued monitoring for hearing status. Now, the point here I want to highlight is, you see the last point, to monitor continued hearing for lifetime. So this is also a part of the newborn hearing agenda, right? Now, what happens, need for the newborn hearing screening? See what happens when the child is deaf. Now, it affects the speech and language. When the hearing is not developed, it affects the speech and language. It affects academic activities. It affects its psychosocial relationship and social relationship. And complete development aspect is affected when the child is not, when the child is deaf. Okay. Now, as I told you, these are connectomes. Connectomes in the brain. Sorry, I'm not able to change my slide. Yeah. Okay. As I told you earlier, this is a brain, and this is the auditory cortex. This is a visual cortex. Okay. Now, if the child is delayed, if the child is born deaf, okay, and it is deprived of hearing for a longer duration, I told you this function, the occipital area will take over the auditory area. Now, what will happen? The child's ability to learn language and learn speech, okay, becomes very difficult if you restore hearing at a very later stage in life. Now, I've been talking about later stage, later stage, later. What is later? How late is later? How early is early? Now, we all know from our definitions. I don't know how many of you know Tamil here. We have a very famous saying in Tamil. It's called ஐந்தில் விளையாதது ஐம்பதில் விளையுமா. That means if you can't learn anything before the age of 5, you will never be able to learn it at the age of 50. So this was written some thousands and thousands of years ago. Now exactly today, all the neurophysiological studies and neurobiological studies have confirmed that the maturation of the auditory cortex, or maturation of the brain, is up to 5 years of age for specific skills, for the skill oriented learning, right? Now, beyond that, when I mean skill oriented, the fundamentals of the skill oriented learning. Now, beyond 5 years, the brain starts slowing down in terms of establishing the fundamental concepts or fundamental functions for learning the higher skills. It slows down. So, that is, language and speech are complex, higher skills. So, if the brain is not trained before the age of 5, the brain will never be able to, you will never be able to train the brain later than that. So the maximum age is 5 years. So anywhere below 5 years is better. Now, when I mean below 5 years, 1 year is definitely better than 1.5 years. 6 months is much better than intervening a child by 1 year. So giving hearing in 1 year will produce more results than giving hearing in 1.5 years. Giving hearing in a 6 months will produce much better results compared to giving hearing by 1 year of age. So this is what I mean. The earlier is always better. That means it puts a lot of responsibility on us to identify and diagnose child as early as possible and intervene the child as early as possible. Okay, now I've got two responsibilities on my shoulders. One responsibility is to identify and diagnose as early as possible, and another responsibility is to intervene as early as possible. I'm sure all the professionals, why the professionals, even everybody in this group, even though you're not a non-medical, you have this responsibility because you are the people in this field. You can influence, you can work towards it, you can convince people, you can help people to diagnose early, and you can intervene early. So we are always there to support that. Now, the point here is, now there is something called the neural scavenging. Now, what is neural scavenging? When the occipital area, when the visual area takes over the auditory area, it's called scavenging. Okay, it's called the neural scavenging. Because of the neural scavenging, we will lose the auditory area for development of hearing and respectively for speech. Okay. Now there is something called cross-modal plasticity. What is cross-modal plasticity? That means you're using a different modality. This is called the cross-modal plasticity. Now, vision is one modality, hearing is one modality. Now, because of deprivation of hearing, the visual area will take over the auditory area, and this is a cross-modal plasticity. And all happens because of auditory deprivation. Now, the critical age for neural plasticity, as I told you, maximum is 5 years, but before 3 years produces very good results, and before 1 year produces excellent results. By 6 months is the best results what we have seen. That means we have intervened a child by 6 months of age. This is our personal experience. We have intervened the child by 6 months of age, and we have also intervened the child by 1 year of age, 2 years of age, 5 years, 10 years, 15 years, 20 years also. But the child who has underwent intervention by 6 months of age produces language and speech as good as any other normal hearing child. There's no difference at all. Okay, so the point is to intervene as early as possible.